Looking back at our history, I feel overcome with gratitude for the community that has kept this mission alive for 40 years. In February of 1986, I wrote this letter to request funding that would cover startup costs and salaries for the agency. This was a step in taking healthy mothers, healthy babies from a community task force to a nonprofit with employees and volunteers dedicated to making sure local pregnant women had access to vital prenatal care. The need for support was so great that even as I wrote this letter, we already had referrals for women who needed assistance in getting care. The foundation for our work was built on a study at St. Mary's Medical Center. It revealed a troubling truth. Mothers who arrived for delivery without any prenatal care were twice as likely to have premature babies, and infant mortality rates rose sharply beyond the heartbreak for families. This crisis carried a heavy cost for taxpayers. We knew that by supporting early and consistent prenatal care, we could change lives and strengthen the entire community. When the alarm sounded on maternal health in Palm Beach County, our program sprang into action. Thankfully, we saw great results. By 1990, Healthy Mothers, Healthy Babies had reduced walk-ins in St. Mary's Medical Center in West Palm Beach from 478 in 1985 to just 151. That meant fewer emergencies, healthier mothers, and a stronger future for infants. In this letter, I shared the coalition was formed to serve as a focal point for bringing together the multiple interests in maternal and child health to increase public awareness of needs and the importance of healthy birth outcomes. I'm proud to know that since then, we have been delivering on our promise.
While so much has changed over the last 40 years, our commitment to healthy births has not. We were established, there were about 12,000 births annually. Now Palm Beach County averages 15,000 births per year, and we have touch points with more than 65% of the women delivering them. Today, we continue to serve women in need of access to prenatal care and offer 9 key programs that are all laser focused on improving birth outcomes. These programs are always evolving to meet the needs in our community. Early on in our mission, a significant focus was teen pregnancy, as nearly 12% of births in 1991 were to young mothers. Today, we offer casework for young moms and operate Caps and Cribs, a mentoring program where teens can set and achieve educational, career, and parenting goals. Now in Palm Beach County, only 3% of births are to teen mothers. Our Centering Pregnancy program was established in 2008. This is a model of evidence-based group prenatal care proven to drastically reduce preterm birth. According to the Centering Health Institute, the cost of preterm birth and related conditions is more than 10 times that of a healthy baby. Centering could save the healthcare system $8 billion each year by preventing preterm birth alone. The rate of preterm birth among our centering moms has been lower than the county and statewide averages. In the past, we partnered with other organizations to offer support groups, but in 2016, we established Circle of Moms to be a dedicated source for maternal wellness. Our team of mental health professionals offer over 50 groups on a monthly basis. Since our inception, we have been supporting families with Baby Basics, what is known today as the Basics for Babies Emergency Pantry for Infants, is constantly growing. Last year, we served more than 11,000 babies through the pantry. In response to the devastating disparities in maternal health, Stronger Together Doula Support was launched in 2021 to reduce maternal morbidity and mortality in women of color. To date, we have certified 50 women to become doulas, and they have supported the birth of 121 Healthy Mothers, Healthy Babies clients. This is only a fraction of the whole picture. Each of these program data points are more than a number. They represent moments of connection and community that builds a brighter future. Despite these compassionate, dedicated, and sprawling efforts, troubling trends are emerging. Since 2020, the number of women going into labor in Palm Beach County with little or no prenatal care has been rising. In 2024, it reached its highest level since 1990. At the same time, fewer women are accessing care in their first trimester. We refuse to go back. We know there is more work to do, and we are up for the task as we continue to deliver on our promise.
As we reflect on 40 years of impact, we know how important it is to be sure our agency is set up for success. Based on early conversations with our staff and key stakeholders, we know the barriers are significant and complicated. Our team strives to anticipate challenges so we can be ahead of the issues our moms face. At the start of our current fiscal year, we launched a 3-year strategic plan. After a period of growth, we are taking this time to stabilize and refine our mission. This will allow us to hone in on the latest trends in perinatal health and break down the walls that keep families from accessing care and seeking support. These challenges faced by our moms are not individual failures or obstacles to be faced alone. They are systemic issues that will require a multifaceted approach to improve. Like it did in 1986, it will take a community effort to ensure mothers and babies are getting the care they need and deserve. We are ready to be the force behind these changes, but we need you, whether through advocacy, collaboration, or investment. Your involvement is vital to ensuring every family in our community has access to the perinatal care they deserve.